We chose a primary endpoint of something called a CY box, which is a validated scoring system for looking at OCD. And we picked this because OCD is one of the major criteria for making this diagnosis. And there was a clinically relevant improvement in children that were treated with Panzyga in this study, but it did not reach statistical significance because there was also some improvement in the placebo. Many times in clinical studies, when you start bringing kids in and observing them and looking at them and doing things with them, they get better just from being part of a clinical study and having all those other things happen. So even though there was a clinically relevant improvement in the CY box, and it was greater in the treatment group than it was in the placebo group, it did not hit statistical significance. We were hoping for a p-value of 0.05, and we got a p-value of around 0.07 instead. The secondary criteria that we looked at was the CGI, or Clinical Global Impression. This is a broader tool that looks at essentially how sick the child is. And so it's going to include other things than just OCD. It's also going to include those minor criteria that I talked about, the neuropsychiatric symptoms that come as part of this. And there was a clinically relevant and strongly significant improvement in the CGI in the children that were receiving treatment. I think there's a lot of research that needs to go on in this field. The first thing is trying to understand why the CGI was a better readout, and thinking about using that moving forward in these studies, because it does seem to look at more than just the OCD component. I think other things to look at are there other immune modulatory drugs that we could use for this? Potentially ones that are less expensive or have fewer side effects than Panzyga or other forms of IVIG do. I think research into looking for some sort of biomarker for this disease would be really great. There are a lot of diseases that don't have biomarkers that we treat. Depression doesn't have a biomarker, and we treat that. And so there isn't a reason not to treat that based on the absence of a biomarker. But because it is a relatively complex assessment that needs to be done to make sure that the OCD you're thinking about is really OCD, and to do a full evaluation of these neuropsychiatric symptoms, if we had a simple blood test or microbiome test or something else that could help us get to a diagnosis quicker, I think that would be a real strength.